All right, you are back listening to another episode of the Haitians in Medicine podcast, brought to you by the Speak Up Network. Today we have Miss Eden Bellegarde.
Hey.
Miss Eden Bellegarde is a peds hematology nurse, and she is currently pursuing her doctorate in nursing practice and psychiatry or psychology.
Mental health.
Mental health nurse practitioner. So, Eden, let's hear, how did you get started in nursing? Where did you find your like, what was your calling that made you get into all of this?
So I actually started like my whole nursing
Wait, give me a second.
journey.
This has to be like a pistol.
Okay, my bad. So my whole nursing journey.
Like, you see how mine is right here, so I can hear you, you can hear me very clear?
Okay, can you hear me now?
Yeah, but you can bring the mic up if you want.
So my whole nursing journey started when I was in high school, actually, because I was in HOSA. So with HOSA, I was able to become a CNA, like, at 16, whatnot.
Yeah, me too.
And then, so that's basically where my journey started. And I had my teacher, Miss Moss, like, she was very influential in my life. So at that time, I didn't want to particularly become a nurse. I wanted to be a doctor, a pediatrician. But I know I wanted to go to nursing school first and then, become a doctor. But my first day of nursing school, Dr. Goodman, Dr. Goodman, one of her lectures that she gave just spoke to me, and I was just like, you know what? I don't want to be a doctor. I want to be a nurse. Like, I loved how she said that basically nurses, we're the backbone of the hospital.
And we really are.
I mean, the patients, they know us. Like, we know the patients better than the doctors. We're basically telling the doctors, like, okay, this patient needs this, this, and that, and they'll do it.
Yeah.
So I really like that type of autonomy and whatnot. So that made me want to become a nurse as opposed to, becoming a doctor, a pediatrician, whatever.
So what are some of, like, the hardships that you had to face before you were finally able to be where you're at right now?
Well, okay, with FAU.
Oh, Lord.
Right. So actually, let me backtrack a little bit, because with FAU, the program is hard to get into. And a lot of people used to try to deter me. I never had a plan B, C, D.
Me neither.
This was my only plan. FAU, like, I'm already here. Like, this is the program I'm going to get into. So people were telling me they had, like, 3.8 GPAs and whatnot, and they weren't getting accepted. So I'm just like, where am I standing with my 3.4? Where am I going? So I got the interview, and I was like, you know what? Since I'm already here, they're interested in me. The only thing I can do is try to sell myself and smile and whatnot. So I did that, and I was able to get in. But the whole journey, it was tough. It was honestly tough. It took me, honestly, 4 times, but I don't count the first one because, like, I kind of winged it, and I didn't know what I was getting myself into as far as the TEAS test, the entrance exam.
And, by the way, the TEAS test, you cannot use a calculator.
Right. So it took me, not counting the first one, 3 times in order for me to get the minimum score. I barely passed. And I was like, okay, this is it.
Wow. So, okay. So outside of those, because, like, anybody who I know started out early, especially at FAU, they're always talking about how hard and rigorous it was to get in. And even me, I was one of the people that, like, fell under that. Like, I was, even with my GPA, I got denied the first time. And the second time I tried to apply, they changed the program. The program was gone, and it was like, now it was direct entry nursing. So once that all happened, what were some job experiences that you seeked after that to make sure that you were well prepared to be a good nurse?
In regards to,
like, did you ever be a nurse extern, or were you ever, like, did you ever work on your CNA license?
Honestly, I tried to work on my CNA license, but I guess I faced discrimination because of my size and whatnot. So I literally had hospitals tell me, or like nursing homes tell me, like, I'm too small.
Oh no, they're not lying. They're not lying, sweetheart.
So I mean, I understand that, but
looking back at it now, like, with my experience, like, even me, like, I struggled a lot because of my size. Like, you have, like, these 600-pound patients, and it's just, like, little old me and another little old person. Right. It's, like, good thing, like, things have changed now. People like a lot of companies are now investing into the Hoyer lifts. Long time ago, it used to be you, your body mechanics, and someone else. But like, I understand now, like, but I think these people should have given you a chance. It doesn't make any sense why you wouldn't hire somebody.
I agree, but I never worked on my CNA license. So prior to nursing school, prior to becoming a nurse, I didn't really have any like health related job experiences, I guess you can say.
Okay. So now that you become like a nurse, how did you even get a job into PTMO? Because that is like a very specific specialty.
It's a very specific specialty, and you know why? This is why I always say never, because in nursing school, I will always say I never want to do peds oncology. I used to always say that because we used to go in the hospital, do our clinical rotations, and my peds rotation was on the Heme floor, and I was like, I can't.
So for the listeners who don't know what Heme is, what is that?
Heme is hematology oncology. Basically, we work with blood disorders and cancer in the pediatric population, so the little kiddies. I work with kids who have cancer, and like I said, in nursing school, I used to always say, I don't ever want to work in this. So, job applying, it was strenuous. It took me a while. It took me like 6 months. I'm struggling right now. Honestly, it took me 6 months to find a job. So, I'm not going to lie, you get denied left and right from different hospitals. They're looking for certain things and whatnot. It's a really hard process to apply for a job to become a nurse. People think that once you graduate, you get it. Some people, if you're lucky, yes, but the application for becoming a nurse is actually pretty strenuous. So I was like, you know what? I found this one. Let me just do it. Whatever. So then, boom, I get the interview. I was like, dang. So I literally told them in my interview that I'm afraid of this patient population. But I did so well in my interview that the director of nursing called me the same day. And she had a conversation. She had a conversation with me. She was like, if I was to offer you this job position, would you take it? Like, what are your fears? So I basically told her, I'm actually really afraid of this patient population. Like, I don't know anything about cancer. It's like, I don't want to deal with that, whatever. But I was like, if you were to offer me a position, then I'll take it. I'll just learn to face my fears. So that's what I ended up doing. So I've been in this field for 3 years now, and it's really tough, especially as a new grad starting off in this field. It's really tough. But honestly, for any nurses or student nurses listening to this, don't let your fears get in the way of trying something new, because now that I'm in HEMONC, I honestly feel like I can do a lot more because I was thrown in as a new grad. I feel like my skills are pretty up there. Like, there's nurses who float to our unit who hates it. They'll cry. They have teary-eyed. They're scared. And I'm just like, okay, let's put this report to the side. Are you okay? Like, you'll be good. Like, it's okay. So, my unit is one of the units that people hate floating to. It's a lot. So, but I love it. I hate it. It's a love-hate relationship.
So one of the downsides I can definitely say for peds, hematology, oncology would be that, like, some patients don't make it. Some patients die. How is it that you deal with your mental health and dealing with your patient's death, knowing that, like, this patient might not make it tomorrow? Like, you might leave your shift, come back the next day, and that patient's no longer here.
It takes some getting used to, honestly. Even now, like, I'm not used to it, and I don't think I can ever get used to it, hence why I don't want to stay in this field for so long. There was a point where we were just having, like, a bad period. We had, like, 6 kids within, like, a week span.
Oh, my.
Left and right. So it takes a lot of getting used to, but at the end of the day, different families approach death differently. So if you're, like, peaceful and you're, like, accepting of it, some of the kids, too, they're aware. Like, they know. So once you're accepting of all of that, it becomes a beautiful process. And then there's other parents who wants to prolong their life, even though they're told, like, there's nothing that can be done. That's where it gets ugly, and that's where things get really, like, complicated, and it leaves a bad memory on the parents, because it's like you're putting your child through so much when...
You ever seen the movie My Sister's Keeper?
Mm-mm.
So it's pretty much about, it's with Cameron Diaz and Abigail Burdick, where the mom pretty much had, she did in vitro, and she had a baby that like specifically had like the perfect blood type for the other sister who had leukemia. And she made the sister do like blood aspiration. You don't have to put this on the show, but she made her do like blood aspiration on her leg to do stem cell transplant. And pretty much the girl literally was like on her last leg dying, and she's like, I just want to go to the beach. And the mom's like, no, we have to stay here so that you don't just get another infection. And she's like, the girl's like, Mom, it's like,
I need to watch that.
Yeah, girl, it's on Netflix. My Sister's Keeper. Cameron Diaz. Good movie. But back to what we were saying. So you said that you wanted to change. So now you're doing mental health. What sparked that change to go like to leave the whole peds hemo-oncology behind, and now to do mental health, where it's a completely different population and it's a completely different type of patient?
Right. So honestly, just rerunning back 3 years as a new grad RN, I was dealing with a lot of anxieties and going to work and all of that stress. Like, we're not prepared for that aspect of nursing. And when I went back to get my letters of recommendation for school, I had a conversation with one of my professors, and I told her like how it is. And basically she told me the same thing. She was like, we don't prepare you guys like adequately for nursing because we don't want to scare you guys. I'm like, that's not right. Like, we should be told, we should be told what's real. So just dealing with like managers, and like, you can get in trouble for anything. Any little thing. And CYA is very important.
Oh, definitely.
So it's just all of that.
Cover your bottoms, friends.
So all of that, it just took a toll on my mental health. And like, I wasn't happy. And then I'm like, I kind of want to, that's when I really started to take my mental health seriously. Like, I never really, mental health, okay, whatever. But like nursing school, like, it was like, okay, whatever. But now it's like I was actually taking like the precautions and like steps to promote like a healthy mental health. So I would say like dealing with my anxieties as a new nurse, and then my grandma's death last year just put everything into perspective. Because at the time, like, I was over nursing. I'm not gonna lie, I was over nursing, over the field.
Burnout is real.
Burnout is so real. I was just done. I was like, do I want to be a nurse still? Like, what do I want to do next? But then when my grandma died in May, that just put everything in perspective. Because I'm like, if she was in the United States, she would have still been alive. That
is very true.
So that just put everything into perspective for me. I was like, this is why I became a nurse to begin with. Like, I have a greater purpose. I have a greater goal. So I was like, you know what? That's when I was teeter-tottering. I was like, do I want to be an FNP, family nurse practitioner, or do I want to be like psychiatric and mental health? That's what I love. So I was like, you know what? I'm going to go with that route instead. So that's what I did.
So how has it been so far? How do you like the program so far?
I'm not going to lie. Like, it's hard. Like,
especially in this quarantine.
In this quarantine and being out of school, it's been 3 years since I've been in school. So I've had that much freedom. Now it's having to go back into that routine of where I was in undergrad, where it's like study. I'm not even there yet. I'm a month into being a new grad student. And it's taken a lot of getting used to. I'm still adjusting, honestly. I just can't wait to get into my core classes, though. But it's a lot. It's a lot. Especially with balancing a full-time job. That's something that I never used to do as well. Like, in nursing school, I didn't have.
People don't understand that. People are like, oh, they have to do full-time jobs with their majors. It's like, nursing is a whole other beast. You can't even breathe like the wrong way without jeopardizing something.
Right.
And it's like, it's really hard. How do you find your balance? Because I know, okay, you're in a relationship, you have a full-time job, you love to travel. Well, before this COVID thing.
Right. So honestly, that's the most challenging part for me right now is like finding a balance. Like, I find myself doing more free stuff than actually studying. So now, actually, this week is when I started like really getting down on myself on schoolwork, because I was putting that on the back burner.
Oh, girl.
I've gotten so used to like this freedom. Like, okay, I go to work and then I have all this free time. It's not like that no more. I got school now. I'm a full-time student. I'm a full-time nurse. Like, I need to find that balance. So it's a work in progress. I'm still working on it. I'm going to get there, though.
Girl, tell me about it. So now that right now you see yourself as a grad student. Mm-hmm. What are your future goals? Where do you see yourself in the next 5 years?
In the next 5 years, I definitely want to work with the Black population, specifically adolescents, and then even more specifically, those who are suicidal, like 14 to 24. Like, I don't know why I've always gravitated towards that topic and that side of mental health. Like, that just bothers me, like the fact that somebody is so disrupted, like
at that age, yeah,
in their minds. Not even at that age, because not even 10-year-olds are doing that. They changed the bracket. So now I think it's 10 instead of 14 and 24. I think they lowered it down to 10, because now 10-year-olds are over here committing suicide. So it's like, why is that? That really bothers me. So I want to.
And there's a lot of factors that play into it. Like, it's never just one thing. Like, you know how, like, okay, let's say someone has a stomach ache. You could be like, oh, they have gas, and you could fix the gas. Like, with mental health, so many different, like, things could play into it to make that person just snap.
So with that, like, I also want to, like, have some type of, like, community center for adolescents in regards to, like, their mental health. And then I also want to start, like, some type of, like, community for nurses and nursing students in regards to the real life nursing, because that's something that we're not taught as students. And that's something that's very beneficial. When I was talking to my professor and I was telling her how nursing is, she literally told me, this sounds like a haze. I was just like, you're not lying.
You're really not.
And she was actually shocked that it was still like that. And I'm like, well, this is why we can't retain nurses. This is why nurses are leaving.
And then this is supposed to be the year 2020, the year of the nurse.
The year of the nurse, COVID-19.
Yes. It tested us the most, and most people haven't. So what advice would you give to someone, like, who sees you as, like, okay, oh my gosh, I want to be just like Eden. Like, what advice would you give to someone like that? Like, someone who didn't make it into nursing school the first go around, like, who didn't pass their T's.
First of all, I want to applaud you, because I love like people like you who don't let that obstacle bring them down, and you still keep going.
It was hard.
It was hard. There's like a handful of people that I know that didn't let that deter them. There's some people that would have quit. So I really admire you for that, that you kept going until you reached your goal. And now you're back in school to get your BSN. So I love that. So I want people to really look at nursing for what it is and not what's glamorized on social media. I hate that, because there's some nurses on social media that makes it seem all perfect and it's so nice. And
people think it's fun up until you have to reuse your mask on a COVID patient, up until you have to reuse a gown.
I feel like social media, like, sometimes it's deceptive of what our field is. Yes, it's a stable job. Yeah, but can you handle it mentally? Can you handle it physically? Because burnout is real, like you said. So I would want people to, I guess, look at me and feel inspired and really look into nursing as far as, like, is this what you want to do? Like, truly want to do, because it's a lot. It's a lot. And
there's no, like, you can't, like, there's no nursing that's easy. Yeah. There's none.
Right.
There's none. Like, people could be like, oh, I went into admin because it was, no. Admin, they'll fire you in a minute if those scores are not up. Oh, your scores aren't up this, it's either you take this pay.
Like, as a nurse, you could be fired at any minute.
No, I'm saying, like, no, some people would leave and be like, oh, I'm going into admin because it's easy. There's nowhere that's easy. Like, every single piece is hard. So it's like, if this is what you want to do, like, you're going to be dedicating your whole life to it. Like, and you're going to be dedicating.
That's a question that people need to ask themselves before, like, wanting to switch careers or, like, even going into the nursing field. Is this what I want to do? Because it's not easy.
It isn't.
and you don't get the appreciation a lot of the time.
Oh, you really don't.
You don't get the support from management a lot of the times. You're thrown under the bus a lot of the times, and you're just like, what the hell did I get myself into?
It's true.
I'm not trying to scare nobody, but I just want to that you guys know, like, the reality, because that's not what we're taught in school. We're taught to pass the NCLEX. We're not taught to
and care.
Right, and
the caring. Girl, that's all they've been talking about. The caring aspect. Mm-hmm. Where are you caring? Yes, I care, but I'm tired. So, how as a Haitian woman do you see yourself making an impact, especially in our community? Because cancer does affect our community, and mental health affects our community at a bigger rate because people don't even report it.
So, to go back to the whole cancer thing, as a Haitian woman and as a Black woman, something that I learned is that as far as people who need like bone marrow transplants and whatnot, I'm actually interested in donating my marrow, because there's a wide population of Blacks and Latinos who need somebody that can match them.
And it doesn't take too much but a swab of your mouth for them to know if you match somebody.
Like, there's people out there that needs a match and they can't get it because genetically it's like mostly like Caucasians that's donating. So it's like, how about those little Black kids? How about little Hispanic kids that can't find a match because genetically there's no match? And as far as mental health in the Haitian community, girl, you already know that's an issue right there. So I really want to take the strides forward to like break the stigma in our community. Like, like, oh, if something's going on, oh, lifu, oh, voodoo. Like, no.
Jab.
We need to educate our Haitian community, like, honestly, in regards to mental health. So hopefully, in the future.
Definitely. So, Eden, let the people know where to find you on your handles, or if you have anything that you want to promote, let them know about it.
So, you can find me on Instagram, A Dose of Eden. I also have a blog that's also called A Dose of Eden. I need to actually update it. It's been a while. But, yeah, that's basically where I'm at mostly. And, yeah, follow me and ask me anything. That's one thing I always say for anybody, like student nurses, new grad nurses. My DMs are always open for questions. That's something that I never deny. Like, if somebody that I don't know slides in and asks me something, I'm always so quick to answer. So, yeah, ask me anything. Honestly, I'm here to talk.
All right. Thank you for coming today, Eden.
Thank you for having me.
So, guys, make sure that you listen to this episode on Apple Podcasts, Spotify, and now the channel is renamed at Nay Knows Best. So make sure you follow us on Instagram for when this episode is posted, and we'll see you again for next week's episode. Thank you. Bye.